Wednesdays. So this and every Wednesday, join us 8 to 9 p.m. here in BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, good evening. This is yours truly, Dr. Gerald Thompson. Once again on Your Health Matters, really looking out for you. And it's wonderful to be back in the show this Wednesday, 8 p.m. as usual. And remember, you can throw me a question, 457-9997. Whether it's on the topic of the day or something that's troubling you. Don't put it off for when that topic comes up, because that may never be. And remember, 457-9997 WhatsApp, or a straight call, a direct call. We'll certainly be happy to take your call. Last week, on the encouragement of several persons, I started talking about the heart attack. I started talking about the heart attack. And there's another reason why I wanted to talk about heart attack. Well, do you know that although there may be 8 billion people in the world today, every single year, close to 65 to 70 million people die globally. 65 to 70 million people die globally. And guess what? 1/3 of them are going to die from a heart attack or stroke. And in some cultures, it is higher than 1/3. And in other cultures, it may be lower because something else may have caused the death, whether it's a conflict, a war, or something of that nature. And the point I want to make is that of that 25 million people who die from a heart attack or stroke, well, there's close about 11 or 12 million that die from the heart attack, and about 8 or 9 million that die from the stroke. And I want you to understand that the heart attack is coming from blood vessels that's going to the heart being blocked or being affected. And stroke comes from blood vessels going to the brain being affected. So strokes and heart attacks are two of a kind. They're two of the same kind of illness caused by blood vessels that have developed plaques, blood vessels that have developed scabs inside them, scabs that break off and rupture and fracture and cause all kind of problems, whether they cause blockage of the blood vessels where no more blood could go through. And last week, we went through this in a little detail. But as I say, I'm motivated because I'm making the point that, and don't take this the wrong way, of all of us, even here in St. Vincent, 1 out of every 3 persons will eventually die from a heart attack or stroke. Kamal, you got that? Yeah? 1 out of every 3 persons. That's why in the beginning, yesterday, I was talking about prevention and how prevention may be better than cure, and how prevention can help you not just live a longer life, but live a life that is less disease-ridden, that is not wrought with sadness and depression because you're ill. and you're not able to enjoy your twilight years. And worst of all is if you are a young male or even female who will die early because coronary artery disease, heart disease, ischemic heart disease, all these things may be afflicting you early. It may also be afflicting other members of your family and all these other things. Now, so I am raising the point that heart attacks is big issue. And how, as a doctor, do we know someone's having a heart attack? How do you know having a heart attack? And I pointed out some of the symptoms you are having. But from a doctor's point of view, we do a physical examination of you, whether it's in the office, whether it's in the emergency room, whether it's on the street, because someone might have collapsed on the street. And first of all, we notice that your heart rate is running fast. Running fast. You have something called tachycardia, tachycardia. It means tachy, it means your cardiac thing is running fast. Instead of beating, it's your heartbeat. What it's doing is feel your pulse, boy, pulse going like a mile a minute. Tachycardia. Or for that matter, it may even go even faster if the beats have become abnormal. And when I mean abnormal, I'm talking, you don't really want your heart to be beating with those kind of rhythms. Because with those kind of rhythms, no blood is pumping at all. The reason why your heart beats so is because your heart pumps out, then it fills up. Then it pumps again, pumps again. It's fill up, pump again. Fill up with blood, pump again. Fill up with blood, pump again. If it's going, ain't got no time. Ain't got no time to fill up, so no blood is moving. That's serious. Your pulse. We can check your pulse, whether we check your pulse at your neck or your pulse at your wrist hair, let me put it this way. Right below your thumb. That's the way we like to. But sometimes we can't feel that, so we go right up to your neck. We can't feel something, we go to your ankle. There are places where we can feel your pulse other than your wrist. We know how to do that. And these tell us a lot of things, Then we check your blood pressure. Oh God, we got to check your blood pressure. Normally, with a heart attack, you may be surprised that your blood pressure has started to drop. If your heart isn't pumping because of a heart attack, then blood is not moving around your body. There's no pressure to pump it and force the blood right through your body. So your pressure is low. And then if blood ain't flowing around your body, blood's not flowing to your lungs. So your respiration, you want to try still get some oxygen in. So you start to breathe out. Patients who having a heart attack, they're breathing fast because their blood is not moving. So they have to breathe fast to still get a little extra oxygen into their blood. That's the way the Lord has made us. However, after a while, the person's respiration will start to slow as well. We look at the neck. We're able to see your neck veins. And it's not just if you're a person of color, we could still see it. You know what I mean? When your heart pumps, we can see your veins filling up sometimes. And that tells us a lot. And then the heart, we can do several things. We can examine the heart by taking a stethoscope and sounding you, song you, we call it. Kamal, that term, we can song you. So I put a stethoscope and I song you. I want to hear the beats of your heart, how they're beating. When it pumps out, when it fills up. listening to any extra songs. I'm listening to your lungs to see if there's water in your lungs. If your lungs are getting drowned with fluids and water because your blood is not moving. So you have to back up somewhere. When your blood is not moving, it backs up, and it often backs up into your lungs, into your chest cavity. And we look at all these things. We look at your legs. We look to see if you got swelling of your legs. We look to see if your arms and legs, if blood is flowing, your palms are pink. But if your hands start looking blue, you know what I mean? If you're light skin and your arms and your legs start looking blue, that's not a good sign. Doesn't show good circulation at all. And we then look at a number of things. Some of the important thing is if you're close to an emergency room or hospital, we can draw blood. When I say blood, when I say draw blood, I said that in the wrong way. You know what I mean? I mean, we can take a sample of blood for some blood tests. I don't mean we could draw blood from you. You know what I mean? That sounds horrible. I'm talking about we take a sample of blood to send it off to the lab for emergency tests. And your heart, if your heart has undergone a heart attack, the muscles start to release certain substances. And within a matter of a few hours, we can check the levels of some of these particular tests. The things they send above, you should know, right? I mean, it might seem a little bit too technical, right? But we look for something like troponin and creatinine, and we look for certain enzymes that the muscle released, and we are able to check these out. And if some of them come back elevated, we call them cardiac biomarkers. And you see when the doctor comes back, that's when he's going to tell you definitely that there is a heart attack. Now, a special one of those tests called a troponin test is probably the most specific lab test for early detection of a heart attack, right? And the levels of this substance called troponin, right? And the two forms of them, there's a troponin I and a troponin T. Imagine that. And we measure these. I've got to double check to see if troponin tests are available in St. Vincent, right? They should be, because they've now become something of the gold standard. I should have checked it out before the show, but in America and so forth, you're going to have a troponin test along with the other blood tests. And guess what? These substances, they peak at 12 hours. And then after, they start to fall. So if someone is having a heart attack and I ain't going, it's not already a bad heart attack, I'm going to leave it for the next day. And they go to the hospital the next day and they draw blood and they do a troponin test. Guess what? It may be normal because it peaks at 12 hours. The day before, you might have been having a heart attack and you would have had all the symptoms and so, but you refused to go to the hospital. And no one's brave enough to carry you there. And we then, a mistake may be made of not keeping you in the hospital and not being able to tell you you definitely have a heart attack. So you go back home. And that's usually where big mistakes are made. When you're prone to having a heart attack and a heart attack is coming your way, it's coming your way. You know? You go back to your normal activities, you don't rest, you get up and you try doing something, you try chopping some wood outside. You know, you try trimming the grass with a cutlass. You try chopping down a tree that you always wanted to chop down with an axe or cutlass. And boy, that exertion triggers the real heart attack. The one you went to the hospital the day before, but because the enzymes were not elevated, the cardiac biomarker were not elevated, they send you back home. That happens, you know? I mean, some places that's the case for lawsuits, but, you know, sometimes it's justified. But, you know, these biomarkers usually remain elevated though for a couple of days. They don't go back down to normal straight away. Now, we're not going to talk a lot about these enzymes, but I want you to know that your blood sample is taken and sent to the lab to see if biomarkers that indicate there's been some damage to the heart muscle during the time of a heart attack, that we check and see if they're elevated. Now, suppose all you had was indigestion, you know? Suppose all you had was you took some spicy chicken and so forth and that upset your stomach. Suppose it was that you swallow some chicken bone and go down the wrong way and it causes pain and you feel all these things wouldn't give you the same symptoms of a heart attack. But when you go to the doctor and you go to the casualty, they may be prone to sending you back home. But if they do that blood test and they find that the biomarkers are elevated, there's no excuse. They got to keep you so that you are not able to exert yourself. They'll put up a drip. You understand? They ain't gonna pour a lot of fluids inside you. They're just gonna put up a drip because they have to give you medication. They can give you some oxygen. Make sure you got extra oxygen. They're relying on the oxygen in the room. They're giving you some oxygen. They put you on a bed. They're keeping your head, you know, your back elevated and so forth. They ain't letting you lie down flat at all. And the nurses are going to be coming in. Matter of fact, depending on the subject, they may even have you in the intensive care unit just to make absolutely sure, because they have to watch you. They have to watch you very carefully. People who are having a heart attack may have just had the heart attack, or they may be having a small heart attack followed by a big one. And so we want to catch you in time. You understand? Come out? You know, we don't want to mess around and say, well, we are not sure, so let's send you home. And if you feel bad, come back again. You know what I mean? 2 o'clock in the morning, you can't get no ride and all this. You die. But the important thing is we also do an EKG, an electrocardiogram. We put up leads on your arm right across the heart, and we're able to test the current going across your chest, examining how your heart behaves. And depending on the pattern, we could also tell if you have a heart attack. Another way is to do an echocardiogram. This is using a sound wave machine. And this really is helpful. So the diagnosis is important, but the most important thing is how do we treat you? If you come in with pain and you're having a heart attack, you know what we want to do? We want to make sure that we have you nice and calm. We'll give you oxygen. We put up the drips. We would talk to your family members, but we don't want anybody upsetting you and, you know, and upset you. We got to keep you calm and still during that time of the heart attack. After the physical examination, we sent the blood test off and we're waiting for the results. We have to see if this pain is coming back. If you are still having pain, we can give you some medication under your tongue. Guess what? We can give you nitroglycerine. You heard of that before? And some people, you know, really bad. We sometimes give you a baby aspirin. That also helps to dilute the blood and prevent them from sticking together and from clotting and so forth. All these things are very important. But there's rather than going through and tell you how you be treated, it depends on you. It depends on how you have come in. Have you come in with just pain, a little shortness of breath? Have you come in with a lot of pain, and the pain, and we got to focus on getting rid of the pain? Or have you come in and you are unconscious? You're having a cardiac arrest. Let me say that again. Have you come into casualty because a relative has brought you in, you've been having chest pain, maybe the ambulance has brought you in, and you're clutching your chest? The pain is, as we described it, is going down your arm, is going to your jaw, you're short of breath, you're sweating a little bit, your palms are sweaty, you're a little nauseous, all these other things. We look at those things. Or have you come in and you're short of breath? The person can't breathe. They have a bad heart attack, an extensive heart attack. Or have you come in unconscious because your heart, the extent of your heart attack is so bad that blood isn't pumping at all? And you come in, and we know whether they're doing it in the ambulance or not, we have to do what we call CPR. We have to start to press on your chest and give you oxygen, because that's the vital thing. We can't allow a second to go by. We can't allow a minute to go by. We can't go and have coffee and let's see if you recover. We have to make you recover if you've had a cardiac arrest. And so we pump on your chest. We press your chest, pressing your chest and pressing on your heart. And I'm simulating as if you are pumping. Your heart is pumping. But really your heart muscle is shut, most of it. Now, we can recover, but we are going to do some temporary pumping for you. And we're going to give you oxygen. The oxygen could be, we breathe into your mouth, down into your lungs. And we have ways of doing, or we could put a tube in to your mouth and intubate you. Have you ever seen that before, Kamal? We take a tube, and the tube is actually quite thick. The tube is a little thicker than this pen, and it's flexible, and I'm going to put it down your throat. I don't want it to go down in your stomach. I want it to go down into your lungs. And it stick out the side of your mouth. And we're going to take a bag, and we are going to pump air directly into your lungs. It's reminding me of those days when I used to do that. You know what I mean? It gives me a little chill. Again, trying to recover somebody. And usually you would have somebody squeezing the bag, giving air a certain amount of times per minute. We're checking the blood pressure. We're checking the pulse. If the pulse is moving too fast, we have to bring the pulse down. If the pulse is an abnormal rhythm, we can give medications so that the rhythm can be stabilized. On the other hand, if we find out that when we examine your heart, you have a flat line, or you have an abnormal rhythm that isn't going to be consistent with life, we have to zap you. We have to give you a cardiac arrest. We have a device like this, and we put it on your chest, and it's charged, and I've charged it up to a certain amount of energy, amount of joules, and I say, zap. I can press the button, and I'm zapping you. That electrical current, I am trying to pass an electrical current from one part of this device to another part of this device so as to stimulate your heart so that it starts beating again. And boy, sometimes this works. Sometimes it doesn't work. Sometimes we have to keep on going and turning up the energy and giving you a bigger zap again, you know? And we could do it several times. But we give you medications like adrenaline and other things like that to make sure that you stand the best chance. We don't want to say, boy, we've lost this one. I have seen people recover. The worst situation is that we take a knife. I hate to do this and we cut down your chest. And with gloves on, I will take your heart in my hand and I start to squeeze it to simulate, because pressing on your chest may not produce the best mechanism. And I can use my hand to squeeze your heart, to pump it around. Later on, I'll sew back up your chest. You understand? We'll sew back up your chest. But right now, it's to make you recover. These are the things we have to do for someone who has had a myocardial infarction. If they have it mild, then it's rest, oxygen, be in a room, and so forth, waiting for the blood test to come back, and we fix you up. If it's somebody who's very short of breath, we give them more oxygen. We stabilize, we calm them down. We might even give them medication to calm them down, right? And then if it's someone who comes in a cardiac arrest, there's no heartbeat, right? Or the heartbeat is abnormal, we have to zap you, give you, with energy and get the electrical current to run through your heart. Hopefully it will stimulate your heart to start beating again. If there is still good muscle there in the heart, if there's bad muscle, if the muscle has been damaged already, then it's not going to recover. And boy, we've seen people miraculously recover. So the important thing is that someone who has had a heart attack, whether it's a mild heart attack or whether it's severe heart attack with cardiac arrest, has to be in a hospital. This can't be treated at home. This can't be treated at your uncle's house. We can't treat it in the studio here down at WFM. We have to have you in the best institute. That's why I was so keen on seeing that acute referral hospital at Arnesville. And hopefully I can't wait for that thing to be built, because I don't know if I'm going to be one of the 1/3 of Vincentians who will die from a heart attack or stroke. With those odds, I want to make sure the right facilities is there, that has the zapper, that they could zap me back out of an abnormal rhythm. Or if I have a flat line where my heart ain't beating at all, I want that. They come out, you want that too, right? You don't want them just go and say, and make the sign of the cross and say, God bless you, we'll pray for you and so forth. You will pray for me, but also, and prayer is so important. Don't get me wrong, but I want the full action. I want the full stuff to kind of make me recover. You know what I'm saying? Now, we look at things really depending on if someone had a mild heart attack, if someone has had a moderate heart attack, or someone's had a really bad one. That's more or less it. There are different ways of looking at that. And when several weeks has gone by and the person recover, they usually may want to look at your coronary blood vessels. These things sometimes are not done too early, unless it's a mild heart attack or a mild, but we want to see which of your coronary arteries are blocked. Is there just one of them blocked? Is there two of them blocked? Is there three of them blocked? Or all of them blocked? All four of them. Now, some of these things, they can be just narrowed. The blood vessels could be narrowed 30%. But when a blood vessel is narrowed by 80%, I would call that blocked. You know what I mean? So we assess that by shooting some dye up to a specially placed catheter near your heart that shows the dye going into your coronary arteries, and we're able to take x-rays to see if the coronary arteries are blocked. We call these tests angiogram. An angiogram, angiogram, and that tells us so much. It's difficult to approach heart disease if you're blind, if you're not looking at things in the right way with the right information. Having accurate information where you could see which arteries are blocked can be helpful. Because today, what we could do is we could send in a probe, a little wire. Yes, send in a probe into your, what they do, you believe it or not, they actually could use your legs, the artery in your legs or maybe in your neck, and go in, and we could actually do some special type of surgery that if your blood vessels are narrow, you know, you drive along a road and people have double parked, and you can't pass. Well, if a bulldozer comes by and basically pushes those cars away, then you could get by. That narrowness has gone. So there are mechanisms in which they could remove the actual plaques, the scab. But in removing it sometimes, boy, pieces could still get away. You know what I mean? Another method is by putting in what's called a stent. They have a little device, like a little thimble, like a little ring. And they're able to put it in their very small ring, and they allow this ring to expand and push back out the blood vessels. So where it was narrow, not allowing a lot of blood, they could have that ring expand a little bit. There are ways of doing that, so that it's now opening up the blood vessels to almost what it was when you were 19, 20 years old. You know what I mean? Maybe not so much, maybe about 25, 30 years old, but they could open it up. You know, if that doesn't work, you know, they can do what's called bypass. You know, they can take veins from your legs and so forth. Come on. And they could go and put it into your, or they could take special plastic and rubber blood vessels and make a bypass. So, in other words, they can create a new road, a new pathway for the blood to follow, even though the old one is blocked, right? And these are called coronary bypass. And somebody's having a triple bypass and a quadruple bypass. And there are people in St. Vincent who I know have had that, you know? So the important thing that we also want to know is that afterwards, the patient is placed on some medication to stabilize them. Normally, we put the patient on aspirin. We know why we put patient on a baby aspirin? A baby aspirin tends to thin the blood, and what it does is to prevent the sticky parts in your blood, the platelets, from sticking together, right? But the aspirin has to be in a small dose. In other words, you're taking big doses of aspirin. Big doses of aspirin you take for pain, but you ain't want that. To prevent your blood vessels from, to prevent your clots from appearing in your blood vessels, you need a small amount, just 81 milligrams of aspirin, rather than taking 2 tablets at a 300 and something milligram tablets, almost 700, 800 milligrams. You ain't want that. You want 81 milligrams, a baby aspirin, we call it. And that works to thin your blood. The big aspirin wouldn't thin your blood. They will just eliminate pain or help with pain. Now, in addition, what we do we slow your heart down. We put you on some tablets, call them beta blockers. We put you on some tablets to also slow your heart down. And we also want to make sure that we want your blood vessels to expand a little as much as possible. So we put you on other tablets. We sometimes would also do things that we want to dissolve the clots, right? That's been causing a heart attack because they could form again. And there are all these different things to allow blood to flow again. So whether we're going to give you aspirin to prevent clots, whether we're going to put you on tablets to slow your heart, but come on, if we slow your heart down and calm it down, your heart isn't so active. You know what I mean? Still able to work, but it isn't going a mile a minute and racing away. We could give you tablets to open up your blood vessels a little bit more. We call ACE inhibitors. All these kind of things are good. Or we can start getting into some medications that actually going to actually dissolve out the clots themselves. And so that's very complex. So really, recovering from a heart attack is a big thing. Same way recovering from a stroke. Today, a lot of people are able to do that with modern medicine. But sadly, a lot of people who recover, they go right back to their old habits, smoking, right? Drinking, consuming unhealthy diets with high in cholesterol. You know, they place themselves under a lot of stress. Kamal, if you have a heart attack, one of the big things is, boy, don't be under a whole set of stress. You know, don't get booked. You know what I'm saying? Don't boot and be caught by those things. So I'm saying this other thing because these are some. I probably shouldn't. I apologize for saying that, but I'm just bringing up examples in your household of things that can bring on a substantial amount of stress. And these things are going to further enhance your risk of a second heart attack, a third heart attack. You know, we found that there was a lot of evidence that patients who've had a stroke have a high incident of a heart attack within 3 years of their stroke if they have not been taking care of things properly. You know, and there is this whole process of cardiac rehabilitation. It's an important program for everyone who's had a heart attack, and it involves the physical activity, involves a lot of education, learning about yourself, learning about what heart attacks does to persons like yourself, and so healthy living, healthy diets, taking your medication as prescribed, not taking a chance. Well, if you have to pay for it and so forth, you can't go and say, boy, let me save some money this month. Let me take half a tablet. And you can't say, let me skip tablets for a couple of days because the way the tablets don't make me feel good or whatever. You know, go back to your doctor before you stop them on your own. They may have another solution. It's important to have counseling. Now, I can't emphasize smoking, secondhand smoke, stress reduction. You really got to really get rid of it. And so the heart attack is going to kill 1/3 of us. Well, heart attack and stroke, I'm sorry. And it's worthwhile really learning about how you could stave this off, how you could prevent it, how you could push it down the road in case you still have it. It ain't happening to you now. It means you could still have some time to go out dancing. You could still have some time to go fishing. You have some time to do things that you wanted to do, to travel. One of the people who retire, and soon after retirement, they die, they pass away, never really having the opportunity to really enjoy their twilight years. come on, I want to enjoy my twilight years. You know, I want to enjoy my twilight. I gotta prepare. So I tell you, man, I am gonna do a little bit more tune up with my exercise. I mean, I can't do anything to look good, to look handsome. I'm ugly already. You know what I mean? But I could do a lot to tune up what's happening on the inside. You know what I mean? And it's going to be important that all of you listening to me take this seriously. You have to heed. I don't know if there are any calls. We have 15 minutes. 457-9997, WhatsApp or direct. We certainly be happy to have your calls, hear your experience, the experience of a loved one who may have had this, you know, and maybe we'll be able to answer a few of your questions and maybe help you or help somebody who may have always wanted to ask that same question, you know, to guide them in terms of what is the best solution, you know. We don't see anything lighting up there and so forth, but Kamal, I'll ask you, have you known anybody who've had a heart attack? Huh?
Let me just tell you, Mike. Yes.
You've known somebody who had that. Or you don't have to check.
I actually know, well, I know one person who had a heart attack, and I know two other persons who had a heart attack, but unfortunately they died.
Both of them?
Yeah, both of them died. But
Yeah.
there's one person who had a recent heart attack, but they survived it.
Now, I want to tell you, if you live in a country that is attuned to heart attack, even though they have a higher incidence of heart attack for one reason or the other, but their hospitals and their clinics and everything is geared towards treating heart attacks, the chances of survival is very high. Now, those same persons could be in another country that doesn't have the healthcare system and doesn't have the person in place. Those same individuals may be unlucky to be in the wrong place at the wrong time.
From the two individuals who passed, one of the things that I learned was that they didn't know that it was a heart attack that they were having.
Yes.
Right?
Yes.
They didn't know. One for sure, there were signs. But he didn't know.
And there would have been persons around them who also did not know.
They did not know either.
Let's take this
We have a
call. Let's take this call. Hello, good evening. Good day.
Dr. Thompson, this
Hey.
is service though.
Yes.
All those bombs that are coming down in the Middle East at the moment,
Yes.
and and that ugly smoke, the killers of smoke, you think
gosh.
people are dying from heart attack.
People, I'll tell you something. Do you know one way people die is if a building comes down on top of you and your leg is broken, you're crushed, and you're underneath it, but you can't get out. You may not die straight away, you know, but the stress and so forth, you may not die of suffocation either. You basically go through some changes and if you are at risk, especially in places like Lebanon now, Hezbollah, that they're just bombing that place out for fun. You know what I mean? And I've found these things so sad. But you're right. You know, the stress of being in a conflict zone, right? Of being in, I think, can scare a lot of people. And those who are at risk, the 24-year-old may not die of a heart attack, but the 65, 70-year-old who has some 30%, 40% blockage of their coronaries but don't know it, these are the ones who will typically get popped off, you know?
Okay.
Thank you. Thank you very much. Yes. Yes. You know, and That's really important. I'm glad, a call came through because the circumstances are you may be a person at risk. And Kamal, someone comes and snatches your bag and starts to run off. What's your instinct? Would your instinct be to sit down or go to the police, or you chase after them?
Chase after them.
You chase after them. That's the thing.
That's the instinct.
That's the instinct.
Yeah.
But they may not be fast. So you're like catching up on them and so forth. But you are 65, 70 years old. And as you start to catch up on them, you realize you are beginning to have some chest pain and some shortness of breath, right? And you're feeling funny. The sweating isn't from exertion. You are having cold sweats. This is where a number of people, just like we were talking about in the people in Iran or Lebanon, who are elderly and so on, the excessive exertion that you're going through is requiring more blood, more oxygen, but your coronary arteries are either blocked or narrowed and is not allowing the blood to come through. And that can lead to a heart attack, And these circumstances, the same mechanism, whether a bomb is dropping near you in Iran and you're scared, or you're running after somebody who stole a bag from you, or a bag from your wife, or some other person that you know. And that's a serious matter. Now, in terms of the prevention of this scenario, I want to do this in two ways.
But before you go on to mention prevention, right? What I do believe, and I am still of the mindset, is that a lot of people, right, do not know, will still not know the signs. Because one of the individuals who passed, right, he was experiencing signs like 2 weeks or a week before.
But this is what I was going to get to you in terms of prevention. It wasn't so much I was going to get into prevention of
a heart attack.
Of illness.
Oh, okay.
By starting at the age of 20 and eating the right thing and so forth. It is that, especially in the case of males who don't go to a doctor, who don't get at least an annual physical examination. And part of that annual physical examination is to do an EKG. And the EKG is an electrocardiogram that looks at your heart. It's a chest x-ray to see if your heart is a little bigger than normal. Taking some blood tests to make sure your cholesterol, your diabetes, and also doing a blood pressure check to see what your blood pressure. Then look at your kidneys and so forth. By doing that, you have a baseline and your doctor could tell you a little bit about your risk. And you could have a number of the risk for a heart attack. Once he identifies or she identifies that you have a risk for heart attack, they will start to tell you, these are the things you have to watch out for. These are the signs you have to watch out for. I have found from my experience that the people who don't know they have a heart attack is largely because they have not been or going to the doctor regularly. And that if they had been, some of the risk factors for the heart attack, whether it is high blood pressure, diabetes, whether it is cholesterol, whether it is some of their habits, the smoking, what they ate and so forth, or maybe they were obese, or all these things would have come into play because all of these are at risk. So if 1/3 of us are going to die from a heart attack, right? You know what I mean? If 1/3 of us are going to die from a heart attack, then there must be some greater knowledge. I'm glad with your question that persons should learn a little bit more. That if you lift up a log, that it can give you pain in your muscles in your chest, but these pains are likely to be sharp pains. They're likely to be pains when you move your shoulder and so forth. There's something that triggers it. But if you start to have a dull pain, a pain as if something's sitting in your chest, squeezing your chest, and it's moving down your arm, and if you move your arm, that isn't easing or making it worse, it's just the same, and you're short of breath, you're sweating and so forth, then you would understand these symptoms. And I could appreciate how a lot of persons don't know it. And a lot of people don't know.
Yeah, that's what I don't know.
A lot of people don't know when they have diabetes. You know, a lot of people would have diabetes for 4 or 5 years before they're diagnosed, you know? And once again, it's because they're not going to a doctor. They haven't been right. And so I'm encouraging persons, at least once a year, go to a physician, right? And if it is an annual exam, do a little bit more than just check your pressure and that's it. And let him sound you good. You know what I mean? Let him check out your eyes. Let him take a blood test and send them blood tests off. Yeah, the blood test might cost you a couple of $100, but do it. Do it. A stitch in time save 9. You know, those blood tests are important to show the doctor, give him that assurance that he's on the right track, that, you know, there isn't anything wrong. Because he could feel bad if he comes and tell you, boy, you look good, and 2 weeks later you have a heart attack. That doesn't sound right, you know?
Yeah, let me try.
We can take this last call. Yeah.
Let me make it sharp.
Hello, good evening.
Hello?
Hello.
Hi, good night.
Good night.
Good night, Dr. Joel.
Yes. I think we only have a couple of minutes left, but go ahead quickly.
Yeah, let me thank you for coming back tonight with this topic.
Yes.
But I'd like you to explain what is a nuclear test and why they would give you a nuclear test.
Yes. Well, we don't have nuclear tests available here in St. Vincent. These are some special tests. Like we could do an EKG. We can do a chest x-ray. We can do a CAT scan. We can do an MRI. But there are some other tests where we could inject certain dyes into your blood and we could see the way in which it affects your heart, how your heart is pumping and so forth, and we can get a description of it. And these tests are very important. They've gotten very, very sophisticated. I'm hoping that one day we'll be able to have these tests available in St. Vincent because, you know, to make the proper diagnosis, you can't just do one test. You know, each person is so different. So nuclear medicine sounds very sophisticated. There's very little, but there are these special dyes that have a nuclear base, but don't think of it being any atomic stuff and so forth. It's just a new methodology that's been around for 20 years, but now it is developed into a real art that we are able to see properly how the heart is pumping and whether the heart is dysfunctional and whether the heart is really has lost muscle ability to pump and so forth. And it's an important test. We don't have it available in St. Vincent. I think it'll be a little while before we have it. But we have other tests that can make some aspect of diagnosis. And if somebody is overseas, then those tests will be standard. But I'm hoping one day we'll have them here in St. Vincent.
You really on the ball tonight, and I hope the audience
Yes.
really listen to you, because everything you mentioned tonight is definitely on the ball, and continue do what you do.
Thank you very much.
But two things I want to mention before I go.
Okay. Yeah.
Like people who consume a lot of like Red Bulls and Monsters, a lot of these high carbonated drinks, no good. Fried food, no good.
Yes.
You know,
Yes.
these things help take you down the drain very quick.
Yes. You're absolutely right.
All the best to you guys.
Thank you very much. So everybody hear that advice? So once again, thank you. And this is Your Health Matters. Watch your heart. Care for your heart. This is Dr. Gerald Thompson signing out. Do have a pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
This is 99.9 Radio. Turn it up.
Life is meant to be an open celebration, not enslavement to addictions, human traditions, or mediocrity. Are you living abundantly?
Health of our society, the future and health of our homes depends largely on how we do what God expects us to do.
Join Dr. Claudius Davis on the Full and Abundant Life program here on WeFM 99.9, Wednesdays 9 to 10 p.m. as he explores the elements that might be robbing you and keeping you from realizing your full potential.
It is time to break those chains of bondage. It is time to shake off what's been holding you back.
The Full and Abundant Life program, 9 to 10 p.m. every Wednesday on WeFM 99.9 with Dr. Claudius Davis.
Lord, I keep so busy praising my Jesus. Keep so busy praising my Jesus. Keep so busy praising my Jesus. Ain't got time to die, 'cause when I'm a helping the sick, I'm praising my Jesus. When I'm a helping the sick, I'm praising my Jesus. When I'm a helping the sick, Jesus. Ain't got time to die, 'cause it takes all of my time. It takes all of my time. It takes all of my time. If I don't praise him, the rocks are gonna cry out, glory and honor, glory and honor. Ain't got time to die. I keep so busy working for the kingdom. Keep so busy working for the kingdom. Keep so busy working for the kingdom. Ain't got time to die, 'cause when I'm feeding the poor, when I'm feeding the poor, when I'm feeding the poor, ain't got time to die, 'cause it takes all of my time. It takes all of my time. All of my time. It takes all of my time. If I don't praise him, rocks are gonna cry out, glory and honor, glory and honor. Ain't got time to die. Keep so busy serving my master. Keep so busy serving my master. Keep so busy serving my master. Ain't got time to die, 'cause when I'm giving my all, when I'm giving my all, when I'm giving my all, ain't got time to die, 'cause it takes all of my time. It takes all of my time to praise my Lord. If I don't praise him, the rocks are gonna cry out. Glory and honor, glory and honor. Ain't got time to die. Now won't you get out of my way? If I don't praise him, the rocks are gonna cry. Glory and honor, glory and honor. Ain't got time to die. Glory and honor, glory and honor. Ain't got time to die. Ain't got time to die. Lord, I keep so busy praising my Jesus. Keep so busy praising my Jesus. Keep so busy praising my Jesus. Ain't got time to die. 'Cause when I'm a helping the sick, I'm praising my Jesus. When I'm a helping the sick, I'm praising my Jesus. When I'm a helping the sick, I'm praising my Jesus. Ain't got time to die. 'Cause it takes all of my time. It takes all of my time. It takes all of my time. If I don't praise him, the rocks are gonna cry out. Glory and honor, glory and honor. Ain't got time to die. Keep so busy working for the kingdom. Keep so busy working for the kingdom. Keep so busy working for the kingdom. Ain't got time to die. 'Cause when I'm feeding the poor, when I'm feeding the poor.
This is WeFM 99.9, the Clean Fresh Song, 6 minutes after 9 o'clock. It's time for the Full and Abundant Life radio program with Dr. Claudia Davis. Just to remind you that the Full and Abundant Life radio program is an interactive program. To be a part of this evening's program, the number to call 457-9997. Remember, you can call us direct. You can call us via WhatsApp or send us a WhatsApp text to be a part of this evening's program. So without further ado, let me turn you over to Dr. Davis. Dr. Davis, good night. Had a little trouble connecting with you, hence the reason why. But, the good thing is I always get it sorted. Oh, my God. No, I can't hear you. I'm sure you can hear me. So I'll have to get that part sorted as well. Let me see. All right. I'm working on it. Let's see what's happening here. Okay. Let's see. All right. For some reason, I'm still not hearing you, but I'm sure you can hear me. You can hear me. Oh, you can hear me, but I just can't hear you. I can hear you now. So we're good. All right. Wonderful. You just need to click on the comment and it would be removed from the screen. Yes. So if you want to show it up on the screen, you could just click on whichever one you want to put on the screen, and then you click it and it comes off. Yeah, there you go. No problem. All right. Thank you very much. All right. Well, uh, it's really cold tonight. Oh, it's getting better. Oh, wow. Well, the most I can say to you, all the best. The date of March. Yes. Well, I hope you do remember. My clock always says the same. Yeah. Yeah. Oh, thank you very much, Dr. Claudius Davis. Always a pleasure. Always a pleasure having you on a Wednesday evening here on WeFM 99.9. And of course, providing us with such inspiring and godly messages. There you had it, friends, the Full and Abundant Life radio program with Dr. Claudius Davis. This program comes each and every Wednesday right here on WeFM 99.9. And the invitation is there to join him again next Wednesday at 9 for another Full and Abundant Life radio program here on WeFM. Thank you very much, Dr. Davis. Well, St. Vincent and the Grenadines, it's also time for me to bid you goodbye for yet another Wednesday here on WeFM. It was certainly a pleasure being here, being able to musically entertain you, and also lend technical assistance to our interactive programs. God's willing, to join me on Sunday when I'll be in to take care of your Sunday Classics program. Until then, do continue to enjoy the rest of the evening, and like always, remember to be good, be kind, love you all. My name is Kamal Archibald. Until then, to take care. I'm gone.
99.9 WEFM.